Hello, everybody. This is Caden with Many Minds Village here. I have a couple of topics I wanted to cover in this video. So let's just jump right into it. Hope everybody had a great Easter weekend. I hope that you guys enjoyed your time with friends and family and barbecued and got out into the warm weather for a change here in Utah. It's great. Hopefully, everybody had a great time this weekend. Let's jump into a couple of mental health topics really quick. We want to address with you the new statistics that we were just made aware of for the state of Utah for mental health for juveniles. And they're pretty bad. So I want you to take a minute and prepare yourself for these statistics because they really took us by surprise when we got them. In the state of Utah, fiscal year 2022, meaning January 1 to December 31 of 2022, which is just last year, we were ranked 39th in the nation for our treatment on mental health. That's pretty bad considering that we're near the bottom of that. And we dropped pretty significantly year over year in those statistics. So that's not great. Now let's pair those with a couple more statistics that really drove it home for us and really made sense. Last year, there were 175,000 kids ages 5 to 18, 5 to 17, who reached out for mental health treatment. Now, of course, they can't reach out by themselves, so that means their families identified the need for that mental health treatment and reached out and tried to get access to some mental health resources. Of those 175,000, only 10% of those actually achieved mental health treatment. That's pretty significant. That means 17,000 kids out of 175,000 were able to obtain mental health treatment resources in the state of Utah. Now, we do have the facts, and I can break it down for you by the area, by the county, by your population, and that kind of thing. But it's important for you to understand how bad those numbers are. We also know that of the 89.9% of those kids who did not get resources, we were able to kind of ask in a study what some of the ways that they coped with those needs were. Some of them used social media. Some of them found help through friends, family, psychologists, therapists, things like that on Facebook, TikTok, Twitter, Instagram, all those places. Some of them went a totally different route. Some of those 89.9% went to suicide, attempted suicide, running away, violent behaviors, all kinds of stuff like that, because they said, well, if it was serious enough that we would be able to get those resources, we would be able to get help. So those family members had to deal with the fallout of the fact that their children could not get access to the resources that they so desperately were asking for. That's not acceptable, Utah. That's not acceptable in the slightest. Today, I had a meeting, an interview with the director of the Department of Health and Human Services, Tanya Myrup. I almost said it wrong again. Tanya Myrup spent some time with me today and listened to our questions and helped answer some of the questions about what we as an organization can do to get some early intervention on some of those cases, to bring in some of the funding for some of those cases who there was a good chunk of those that the reason they didn't get the mental health resources was because there wasn't funding in place, because their families didn't qualify for Medicaid, because their families didn't have the money to pay for those resources. So they were unfunded. We here at Mending Minds Village think that that is a travesty. So we are working to find private donors. We are working to find grants, scholarships, and other funding sources so that we can create a fund, create an option for some of those kids, even if it's a small percentage, for some of those kids to access the therapies, the treatments, the psychological testing, the help that they desperately need for those resources, for those testings, for, something even as simple as a peer tutor to come into their home a couple of times a week, sit with them and help them understand themselves. There are a couple of programs in the state where if you find a scholarship, if you find a program who's willing to sponsor it, they can come into your home and work with you. Families First is one of those that we have had experience working with, and they're amazing. We love having a worker come into the home a couple times a week and help us work with our daughter. So because of those statistics, we weren't able to really break that down into what specific diagnoses were being ignored. But we did bring up to Miss Tanya that we think we have done some of our research, and we're finding that if some of those kids had access to the funding that was necessary, they could have gotten that, and we could have gotten that number up quite significantly, actually. I'll do another video and we'll talk about those, rates very specifically. I'm gonna also do some other videos where we talk about some of the diagnoses that are being missed, some of the diagnoses that they don't believe to be serious enough to really give them treatment, because Medicaid won't cover it, because private insurance won't cover it, because families can't cover it out of pocket. Money talks, unfortunately. And especially when it comes to mental health, that's a lot of the reason why some of these families aren't getting help. We are working very highly with the Department of Health and Human Services now. We're going to start working with private mental health organizations like Huntsman Mental Health Institute, Valley Behavioral Health, Wasatch Mental Health, Four Corners Behavioral Health. We're going to work with a lot of those. We're going to try and find out what their needs are. We're going to find out why some of these cases are being missed, whether it is staffing, whether it is funding, whether it is lack of knowledge, whether it's, it could be something where these younger kids, this is a different thing. It's not something that they're used to treating, and it's not something they're used to working with. So maybe some of that's part of the issue. We don't know from our organization. So we're going to reach out to those. We're going to reach out to those mental health facilities. We're going to find out why that is, what some of those answers are. Then we're going to present that back to the Department of Health and Human Services. We're going to also present that to the Office of Substance Abuse and Mental Health. And we're going to show them what's being missed all over the state of Utah. We're going to help them understand what the needs are of the people. We're going to help them understand how we can help these younger kids. Because some of the issue, guys, is, we want to fight the homeless population. We want to help them. But maybe some of this early intervention, maybe some of this early testing, early therapy, early work with these kids can prevent some of that stuff, can prevent some of the homelessness that we see, prevent teenage drug use. Because if we're able to help their mental health, can we reduce the amount of drug use in juveniles? We're also going to work on, trying to find out how to help with child abuse victims and getting their mental health needs addressed as soon as possible. There's a lot of work to be done, guys, and we cannot do it on our own. So we're putting together a plan. We're going to start having these conversations. We're going to start asking how we can be of service and how we can help. Then we're going to start looking for volunteers and advocates to come to work with us, to come and help these kids get the help they need, help these parents find the resources that they're so desperately looking for by the time their child turns 8 years old. We are there. We are in the thick of it with all of you. So we understand, for what it's worth, that it's a difficult road and it's very frustrating. And at times it can be terrifying. Please be patient with us while we figure out what it is that needs to be done. If you have a child in the state of Utah who needs help, who you need resources for, you need funding for therapy, you need options for respite care, for mental health treatment for yourself to get through some of that and understand your child, please reach out to us. We can't help what we don't know is going on. So please join us in this fight. We will be talking with our legislators. We will be talking with U.S. legislators. We will be getting funding in place where it is necessary. We're going to work on creating programs that provide respite care, that provide maybe in-home treatment if that's what's necessary. We are fighting right now for residential treatment for juveniles around 6 to 8 years old who have serious behavioral concerns where you need to get the help for it. We are working very diligently. We work night and day. I hear cases every day. Please help us fight for these children. Join us in our battle. Let us know how we can help. I will keep you guys updated on the progress. I will keep you guys updated on the conversations that happen. I'm going to be doing a video series of behavioral health concerns. Behavioral health is just a subcategory inside mental health, but it covers things like autism, DMDD, ODD, ADHD is considered a behavioral issue. So we're going to address some of those issues, what they mean, what they look like. We're going to address our own child. We're going to talk about why Mending Minds Village was founded in the first place. And we're going to talk very much at length about the battles that we're fighting on the ground. If you are willing to support our cause, if you know of a company or of a private foundation that is willing to help us create this fund to help these families who so desperately need mental health resources, please put us in contact with them. Anything we can do to raise funds to help these families is what we're trying to do right now. We understand that a big part of the issue is financial. Help us create that program. Help us create a fund so that kids can get mental health treatment and they don't have to look very far for it. We appreciate you all. We appreciate everybody's support. We appreciate the fact that you guys call us every day, send us messages, join us on Facebook. I appreciate that. You guys have no idea how much one message, one phone call can make a difference. You guys are amazing. So thank you very, very much for that. I will do more videos later. Be watching for them on YouTube. You can find us on Facebook. You can find us on Facebook at Mending Minds Village. You can find us on TikTok at Mending Minds Village. You can find us on Twitter at Mending Minds Village. We are all over social media. You have plenty of ways to get a hold of us. If you need my phone number, it's on the Facebook page. It's as well on the website at mendingmindsvillage.org. If you have any questions, please send them to me. Again, if you have any resources, if there's any way for us to be able to create this fund, this program to help these kids, please put us in contact with them. We would appreciate it from the bottom of our hearts, seriously. We will keep you guys updated. I look forward to talking to you again. Please, if you're not already following us, go follow us, give us a subscribe here on YouTube. Go over to Facebook, give us a follow, go to TikTok, send all your friends and family, anybody that you know might need some help. And we'll do our best to help you find those resources and or create them if they're non-existent. Have a great week, everybody. We will talk to you soon. Bye-bye.